The COVID-19 pandemic has had a devastating impact worldwide, with the death toll now at more than 3 million. However, Taiwan has managed the crisis better than most countries. Confirmed cases remain low, and the number of deaths stand at just 11. Here's a look at how Taiwan has successfully combated COVID-19. While many countries worldwide are struggling with COVID-19, Taiwan has won respect in successfully controlling the pandemic. But how was it done? Some of the tactics include immediate actions, effective strategies, a strong healthcare system, and a unified effort by the public.
我们这一次很快的，在前年的年底，大陆爆出这个疫情的时候，很快就成立这个中央疫情指挥中心，就马上就开始有 action。我们也可以觉得自傲的地方就是说，台湾民众的水准还是蛮高的，大家都可以了解，就是说，真的戴口罩很重要，所以很多人就戴起来了。
For prevention and control, all inbound travelers must make an online health declaration within 48 hours before their flights arrive in Taiwan. They also need to undergo a 14-day quarantine and report their health status every day. Hugo Flamini traveled from France.
During the quarantine itself, it was really like stay at home, don't go out of your front door. I order on Uber Eats all the time. There were people coming for taking my trash every 2 or 3 days, and every day the person from the police was sending me a message saying, "How are you? How do you feel? Do you have any symptoms? Do you have temperature?"
Since the start of the pandemic in early 2020, Taiwan has had just over 1,000 cases, of which less than 80 were local transmissions. Despite the low numbers, there is still a mask mandate, and a temperature check is required in many places. Also, when entering venues, visitors are often asked to provide their contact information.
In Taiwan, as expected, like everything is very clear. It's just like you follow the rules, you're good, and then you're free to go. And since everybody do that, you can see that the life is just almost as it was before the pandemic.
Rita Chow was a student studying abroad in Spain, but when she returned to Taiwan in February of that year, she tested positive for COVID-19 at the airport. She documented her mandatory stay in a negative pressure isolation room for medical treatments until she fully recovered.
如果外面的打开，这个就绝对不能开，不然的话病菌就会跑出去。那中间呢，它就是会消毒我这边的空气，所以护理师啊什么就可以从这边进来。
I was feeling lonely. I was feeling depressed, but I was telling myself, at least I'm home. At least I'm in Taiwan. If I was in Spain, I couldn't get treated.
Before leaving the hospital, patients need to test negative for COVID-19 3 times, or else they can't be released.
I think it's really, really good, and it's very, very important that they have to make sure all these patients are safe to go out, right? Because if they just test me 2 times, maybe I still have some virus in my body, and it could be really dangerous and risky for the people outside. So I think Taiwan is making the right decision on this.
But that's not to say it's been easy for patients like Kylo. Isolation has taken its toll emotionally.
从那次之后，他们就超级关心我的，就是他们就是每天都送小东西来给我，超可爱的。你看我这边有一束花，我再给大家看，有一束玫瑰花，对，就把它放在床边这样。昨天还送了我一包面膜。
They not only treated me, and also they support me emotionally. So we became friends at the end. They brought me even cards written down their names and say congratulations for beating COVID. It was a really special memory.
Rita and Kai's battle with COVID-19, unlike so many around the world, ended with a positive outcome thanks to Taiwan's focus and disciplined strategy of cooperation between government and the public, all for the greater good. When it comes to the vaccine rollout in Taiwan, most frontline workers at hospitals with active COVID-19 cases have received their first dose of AstraZeneca vaccines. Beginning April 21st, Taiwanese who plan to travel abroad can schedule an appointment and get vaccinated. And 2 locally developed vaccines are expected to be available by July. But experts predict the country won't be fully vaccinated until January 2022. For Annenberg Media, I'm Yi-Lun Wei.